Alright guys, so sometime last year I made my decision that it was time to move away from the ward setting to something different. First of all, I wanted a role that would not require me to shuffle between day and night shifts. I wanted some consistency in my role. I needed actually a 9 to 5 nursing job, but of course at a higher level. There were other issues, but the fact that I wanted my weekends especially to myself was a major driver. As I shared in a previous video, I was somewhat inspired by the research nurses who had seen patients for recruitment into various studies on my ward. Well, to cut the long story short, I landed a split role which blew my mind and has been amazing. So I have been working as a clinical nurse specialist in rheumatology and as a rheumatology research nurse for just over a year. And in this video, I am going to show you just how a typical morning is for me as a clinical nurse specialist in the rheumatology outpatients department. I am hoping that this would give you an insight into what is involved in this type of role. Oh, hold on. In case you're wondering, I am in the UK, not the USA, not Australia, not any other place, but the UK. So don't get things twisted, just in case what you see doesn't resonate with the area you are. So after saying hello to my colleagues and the doctors, I moved to my clinic room to start the day. First thing I do is to check the number of patients on my list and look each of them up on the system, checking what their diagnoses are and making a potential plan before I call them in for a review. This particular clinic was a general rheumatology clinic, which basically is for patients who have already been diagnosed and have commenced some form of treatment over a period of time. Most of the patients in this clinic are stable on their specific treatment. Sometimes people believe that all we do in rheumatology is assess and treat joint problems. I thought so too before I started this role. However, it is much complex than just what we all know to be arthritis. In rheumatology, we diagnose, treat, and manage a range of inflammatory disorders that affect muscles, joints, tendons, and bones. We also deal with connective tissue diseases, osteoporosis, and other forms of autoimmune diseases that I am still learning about after 1 year on this job. That's funny, right? Now back to my clinic. So, my first patient is here. I'll see you guys later. Rheumatoid arthritis. Full stop. The time allocated to review each patient in this clinic is 30 minutes. So normally I use the first 20 minutes to see the patient and discuss all their issues and then make a plan with them. And then the next 10 minutes is used to make my clinic later and any referrals or other things that need to be done for the patient. Alright guys, so that was my first patient. The next patient is here. Let's go get a car actually. See you later. Bye. This therefore means that speed and precision are important at each consultation. So my next patient is a telephone call. I'm just gonna give him a telephone call quickly. Catch you later. Hello, good morning. This is Solomon speaking from Rheumatology. Alright, is this Mr. Okay, amazing. Can you just confirm your birthday for me, please? Alright. So I'm just calling for your follow-up appointment. Is that okay? Is it a good time? Amazing, okay. So, how have you been? Plan, colon. No changes to medication. It was a pleasure to meet you. One of the most interesting things about this job is knowing how to make a treatment plan for a patient on the spot and also watching that patient get better and stable on that treatment over the long term. Alright, the time is 10 minutes to 12 and I've seen 5 patients so far, and I'm going to call my last patient now because she is right here. Alright, that's the last patient and final patient. Now, depending on the clinic and the kind of patients being reviewed, time slot allocated to each patient consultation is between 15 minutes and 45 minutes. As is usually the case in most places, the consultants spend the least amount of time with patients. I still wonder how they manage to review each patient under 15 minutes and still do their clinic later. Well, I guess knowledge and mastery surely count for something, doesn't it? But sometimes this means the patients may not have all the time to express themselves as they wish to, which is exactly why some of the patients patients prefer to be seen at a nurse-led clinic where they have the liberty to talk. I found that some patients just want someone to give them listening ears, and that's how they feel reassured instead of just doing investigations and prescriptions for them to comply with. Howbeit, much kudos to the doctors because they have to handle all the complex cases and they review more patients than we would ever do. More complex conditions like connective tissue diseases are given more time, up to 45 minutes for a review for nurses and 30 minutes for the doctors. All new patients have 30 minutes usually to be seen. Otherwise, routine follow-up clinics have 30 minutes for nurses and 15 minutes for the doctors. I'm sure you can understand now why we make use of dictaphones instead of typing. Guess what comes next after a morning clinic? It's lunch break. Oh, it's lunch break. So lunch break is usually 30 minutes and the window period for breaks is between 12 p.m. and 2 p.m. By 2 p.m. afternoon session of the work begins. Some of my colleagues run their clinics in the afternoon. We do what is called the advice line in the morning and afternoons depending on staffing levels. This afternoon I am doing the advice line. So the advice line is how patients who are having a flare of their symptoms contact us for advice and urgent clinic appointments for a quick review. Well, that's about it for today. I hope you enjoyed this vlog. Don't forget to hit the like button for the YouTube algorithm. And if you are new to this channel, I hope you subscribe for more content. Stay blessed out there. Bye. Hello, good morning. This is Lemon speaking.